Welcome back, dear viewers. Thank you for joining us on Good Morning Kuwait. You know, today we are going to shed light on lymphedema, a medical condition that affects some patients after surgeries or medical treatments and has direct impact on their quality of daily life. And although it may begin as mild swelling in the limbs, neglecting proper management can lead to long-term health complications. So in this segment, we discuss what lymphedema is, its causes, ways of managing it, and the importance of early awareness and treatment in reducing its impact. So with that being said, I'd like to welcome Dr. Nour Awada, certified lymphedema therapist.
Hello, thank you so much for having me here. So before I explain anything about lymphedema, let me explain a little bit about what the lymphatic system is in the body. Of course, the lymphatic system is one of the important systems in the body, as important as any other organ of the body. So the lymphatic system in the body, it is a network of vessels. These vessels are look very similar like the blood vessels, but they are way thinner and way smaller. Lymphatic system also contains lymph nodes and some other organs which are all of them responsible for the immunity of the body and for the drainage of the extra waste fluid of the body, not just the fluid. So when we say this person has lymphedema, it means he has a problem with his lymphatic system. We can call it a damage or a compromised lymphatic system. This problem or damage can have so many reasons. One of the most reasons that we see nowadays is surgery. If the surgery included, for example, lymph node removal or included some chemotherapy, radiation therapy. So these are the most patients that we see nowadays. So you can see it very clearly in their arms, in their legs, can be in other parts of the body, but it's mostly seen in the arms and the legs, which is also, as you said, it really affects their quality of life and make it very difficult for them to practice their life, their activities, because it can add some weight on those patients, and if left untreated, it can cause more serious complication for the body.
Yeah, and so would you say, you know, your specialty, you are focused on one thing in particular when it comes to this field, or are you, you know, in broad general terms of senses?
So when we say CLT, Certified Lymphedema Therapist, the name would say only lymphatic therapist, but lymphedema, it includes the whole lymphatic system. It also includes something called lipedema. The lipedema is also another condition which we treat broadly. But I want to tell you, like, the lymphedema is also not rare. It's just the people don't know that they have it sometimes. But mostly, yes, we focus on lymphedema and lipedema in treating, and all the kind of swelling that you can see in the body.
And so what would you say is the most common causes of lymphedema?
So there are two main types of lymphedema. We have the primary lymphedema and the secondary lymphedema. Most commonly, we see the lymphedema coming after certain surgery, like some kind of breast surgery, prostate surgery, any kind of surgery that is closed for the lymph nodes. As we said, the lymph nodes are part of the lymphatic system. So it's usually help in filtering the fluid of the body. So when those lymph nodes are decreased in number, of course, we can put more load for the lymphatic system. So it will not have the rest or the time to because usually we all have healthy lymph system, unless we have some kind of disease or condition that is making the lymphatic system overloaded. So most commonly we see the surgeries, after the surgeries. But of course there are so many other types of lymphedema.
And also in the introduction, we briefly mentioned that a lot of people might have it, but they are not aware of it. You also gone to that point, you know, briefly.
Yes.
So I want to ask, who is at most risk of having, you know, these kind of symptoms?
Let me shed some lights on the people who are born with it. So when you have the first type, let's talk about the first type, which is the primary lymphedema. Primary lymphedema means you are born with a compromised lymphatic system. It's from birth, it's a defect from birth, but it doesn't mean when you're a child you will know. Sometimes it can show later in life when you're older, or when, for example, let's say a lady has it, but when she got pregnant, there's more hormonal imbalances, which put some extra fluid on her body. So this is the time she got, for example, swelling or lymphedema. So at that time, she can discover or know that she has lymphedema. So if I will give you some signs to know that some people can get lymphedema, we can say like people who get infection regularly. Let's say, for example, in one limb of the body, something we call cellulitis, which is a cellular infection. Sometimes it can be red, it can be swollen and big and shown. People who, for example, after the surgery, they cannot put their rings, they cannot put their watch, they feel some heaviness in one limb. These are all signs that they might have lymphedema, but of course no one can diagnose themselves. But knowing the signs can help them to go and check themselves with the lymphedema therapist or a good vascular doctor who is well known of the lymphedema.
And so the patient now came to you, and now they know what they have. So
Yeah.
how do you assess their condition, and how do you give them the tools to support their life
Yeah.
afterwards?
So we always like to hear from the patient first. I always like to take the full history, because from the history we can know the type of the lymphedema, and it will help us treat better or manage the condition better. So when I ask about the history, I really try to focus on, did you have any recent surgeries? When did this start? Did you feel swelling from long time and you neglected it? Did you have any recent infections? So a full history of the patient. Age is important. The medical history is also important. For example, are you diabetic? Do you have any other medical conditions? Did you have this from childhood? This helps me to know the type also, and to tailor a better treatment plan for this patient.
And then also, speaking about treatment plans,
Yeah.
you've mentioned several times that after surgery is where it's most important.
Right.
So why is that period, specifically when it comes to lymphedema, is the most significant part of treatment?
So let me make something clear. Not everyone who will have lymph removal surgery will eventually get lymphedema, but they are like at 30% more risk of that. But it's important to have awareness, like if you have a heavy limb, or you have some infection, or you felt something heavy in your hand, and this is a sign that you should check, because some people who have done these surgeries, they don't even know what's happening to them, and they think it's okay. So why it's important? Because if we left the limb untreated with lymphedema, let me tell you that the lymphedema has stages, from stage 0 to stage 4. When they come early to us, because they know they have this condition, it's easier for us to offload the lymphatic system, so it can take some rest and do the work for them. But when it's already late, more infections, in very hard condition, it can lead to death eventually.
Oh.
So it's very important to treat it really early. And also this can add weight on the patient, which make their quality of life very difficult. Because this can be like 10 kilos in their arm or 10 kilos in their leg, which can be also more and more. So that's why after the surgery, it's important for the patient at least to know, if I have those signs, I might be at risk, so let me go for a checkup.
And so if it was left untreated, or the patient just ignored it,
Yeah.
is there like a time limit where it goes into a really dangerous zone? Or is that something they can rectify?
So let me tell you, one of the risk factors of lymphedema is obesity. So let me tell you, it can differ from a person to another. Is this person healthy? Is this person obese? Because if they are obese and unhealthy, it can, in a really fast and really fast period, get worse. But if they are healthy, okay, it will take longer time, but eventually they will need the treatment and the management plan.
Yeah. So, sometimes after people have surgery, and this might be a misconception, or it's very common, but people think it wrong, is that they see a swelling and they think, oh, that's just because I have a wound or I have a surgery. Like, what is the difference between regular swelling and swelling that's lymphedema, that I have to go to the doctor to see it? Like, what can I, as a normal person, what can I see? So I know, oh no, this has to go to the doctor.
Okay, so the people who removed lymph nodes or who have done radiation therapy or chemotherapy are more at risk to think about lymphedema. But if you have done, for example, only like a knee surgery, ACL, whatever orthopedic surgery, you have less risk of developing lymphedema. But again, as I told you, if they are obese and they have, like, for example, vascular issues from long time, this is more risk for lymphedema. But regularly, if the swelling that is just directly after the surgery can be managed with ice, some elevation, this is just, it will go with the time. For example, 2 weeks, 1 month, it will go by itself. But if the swelling persists and we felt the swelling is getting worse, this is a question mark for us. So usually the type of surgery, the patient should have awareness that my type of surgery, I might develop lymphedema. Also, a very important information, people who remove their lymph nodes or do any kind of radiation and chemotherapy for whatever surgery they have done, they can develop lymphedema even after 10 years.
Oh.
Even after 10 years. So they should know, they should have awareness that once I feel this heaviness, once I feel my fingers, for example, getting heavy, I can't put the ring, it's disturbing me putting the watch, and they also preferred not to take blood from here or have any scratches, because this will make the swelling and the condition even worse. But the awareness is the key for them.
Yeah.
So expecting that, it doesn't mean like they will have it, but just knowing will make them more relieved, and even they will make them go earlier to management and therapy for it.
Oh, I want to thank you again for taking the time to bring such awareness to that.
So
now the patient knows they have lymphedema. And
yeah.
So let's get into the treatment side of things. Like, what are the treatments? What are the remedies for this kind of, ailment?
So when a patient comes to us, of course, we do a full history, full assessment. But the most way we use is an internationally recognized type of management that we use for the lymphedema. It's internationally used. We start always by the MLD, the manual lymphatic drainage, which is the drainage that will do, it's a very light drainage, not like a harsh massage or anything that you has to press so much. The lymphedema therapists know the full anatomy of the body, so we activate their lymph nodes and we do this massage manually. And then the second thing is the skin care. Skincare can include lubrication of the skin, can include taking care of if there is any kind of dryness of the skin or any skin issues. Third thing is the manual bandaging that we do. Manual bandaging, the pressure can differ from a patient to another. And the fourth thing, which is a very important thing, is the exercise plan that we will give for the patient.
Yeah. I like how you mentioned 3 significant treatments for the patient, and I think 2 and 3 is something that a lot of people can't do in their daily life. But I think the first one is where they are scared of, right? The drainage.
Yeah.
So how would a typical, draining session for the lymphedema go like?
So typically it should be for the patient to know they are getting the correct treatment. They should expect that this lymphatic drainage is very light. Already the lymphedema is a part of the immune system. There is an issue in the immune system of the body. So having pressure or having any harsh treatment will make things worse for them. So they should expect that this treatment is very light in the pathway of the lymph nodes. Where we drain it very light, and it's not painful at all. Actually, it's relieving. Some patients sleep in their session, to be honest. So they should only expect it's light and take it only from a certified lymphedema therapist.
So, and this kind of treatment, does it go for all, lymphedema patients, or are there specific cases where that one has to be the one to take into account? So
we always have to take the full history. Most of the patients can have it, but very, very small certain conditions where patients have some heart issues, severe or serious heart issues like heart failure, liver and kidney patients, we should always take the consent from the doctor. for the conditions, because as I told you that when we drain it, we are again bringing all of the lymph flow to the heart again. So in some patients with heart failure, this is a little bit too much for them. It's an overload of the lymphatic system. But if we take the consent for a healthy patient, it's okay. If, for example, liver, kidney issues, we should talk to their doctor and we collaborate to help the patient in the best way.
Well, I think that's a very great message to wrap the conversation on, is to always consult with your doctors, you know,
Yes.
never use whatever certain methods you have. Always go seek physicians.
Always, always. Sometimes even when we're 100% sure and all the evidence is with us, we have to talk to their doctor just to be in the safe side for the patient, always.
So I'd like to take this opportunity to thank you, Dr. Nour Awada, for joining us and being our guest today.
Thank you so much for this invitation and this warm welcome. I'm happy to always spread and share awareness. Thank you.
Thank you. And also thank you, dear viewers, for tuning in. But we are going to take you to our next report, which is going to be that in the upcoming days, we take you to Brazil, the world's leading coffee exporter for more than a century, to explore how natural conditions and advanced agriculture practices have positioned the country as a key player in the global coffee market, and how this role impacts its economy and rural communities. So stay tuned.